Okay, today we're talking about Medicare. And, we've talked about Medicare a lot. And, in the beginning, when I started making Medicare videos, or when we started making them, we would document everything in the show notes. And I was really doing that for compliance reasons. I just didn't want to be telling you something in abbreviated form on the board or just speaking to it without having it backed up somewhere, on it you could actually get in the show notes and you could go in there and read the documentation of what I'm saying. And we've sort of gotten away from that. I mean, we still have it there, and there's a lot of people out there in the media on YouTube talking about Medicare, and a lot of them are just talking. They're just standing there with their hands in their pockets talking to you. And I really like the system of having things backed up, documented. So what you're going to find um, as we do this today is we've got everything documented in the Medicare and You Handbook. So I want to put it to Tom, and I want Tom to share with you, why are we doing this video? What's the real reason?
Yeah, we're doing this video because Medicare is confusing, right? If you pick up that book that Hans was holding, the Medicare and You book, and you read it from cover to cover, you're going to walk away more confused than you started. There's penalties that could be assessed at times. There's time periods you have to sign up. There's a lot of rules, and trying to figure out which rules apply to you and how do they apply is really hard to do. So what we've done in the show today is we've simplified that 130-page book. The show notes is about 31 pages, really just taking the important information out of that, but really just wanting to simplify Medicare so you can make some good decisions, that you can be a little bit more informed when you're trying to figure out what to do here. So let me bring up the show notes. You can find these below the link our video. They're also on our website at cardinalguide.com. We have the board. And then, like I had mentioned, we have several pages pulled out of the Medicare and You book. If you're on Medicare, they mail you one of these books every year. If you're just turning 65, you will get one here. Again, it's 131 pages, I think. And what we've done is we've just pulled out sort of the important parts. We're not going to spend a lot of time right now, but if you want to, after watching the show, reference back, we've pulled out the pages, and on the board we have the page numbers there. If you have your own Medicare and You book, you can go flip through them and find it in your own book. But again, just really trying to simplify how this Medicare works.
Okay, so what we're going to do is give you an explanation first on this side of the board about Medicare. So this is original Medicare over here, because you need to understand that before you start buying insurance to cover the gaps in Medicare. So we're going to have a little review of Medicare. And I've got here in my hand a copy of the book. And this book you get every year. Some of you keep of it, some of you toss it. You can go on our website if you want to get the full book. And you can also go into the show notes behind this video, and you're going to have all of these pages that are referenced in the page numbers here in there. And then I've got all the yellow part. I've got them yellow highlighted in the show notes that Tom, so when you go to the page, you can just read about all these things, or you could just listen to the video and we're going to walk you through it. So the beginning, pages 9 through 12, is going to give you the overview of Medicare. You have Part A, which is hospital. You have Part B, which is doctor. You have Part C, which is Medicare Advantage. And you have Part D, which is drug plans. So they sound like they all go together, but I know you have something to say about Part C, Tom.
Yeah, when you listen to that, it would be intuitive to think that Part A, Part B, Part C, Part D, I just need to sign up for all of these things. Again, that's one of the areas that's confusing, right? Part C is Medicare Advantage, and that is different. That is not Medicare Part A and Part B. You are disenrolling from Part A and Part B to get Part C. This video primarily today, we're not going to talk a lot about Medicare Advantage. We'll reference it a couple times, but that's not the main point of today's video. We have other videos where we get more into the details on that. But again, why they decided to call that part of Medicare Part C, who knows? But again, it makes it confusing because you think of it, it's like, I need to sign up for all these different parts. Well, maybe not, right? A lot of times what Hans has done is he signed up for Part A and Part B, original Medicare, and then he has a Medigap plan or Medicare supplement plan, which is not Part C, right? That is different than Part C. And then Part D, he has a standalone there. So again, we'll get more into those details. But again, it's another area that just doesn't make a lot of sense. If you sat down with a blank page and you came up with this, you probably wouldn't call it that, if we could change it.
Well, and so if it'll alleviate some of your frustration, Medicare is confusing. And what I'm trying to explain to you is that when this bill for Medicare was passed in 1965, all you had was Part A and Part B. That's it. And then you had basically one Medicare supplement policy that they came out with very quickly. And then a number of companies got into it. They were pretty similar. And so it could have been 2 pages. You had Part A, hospital, Part B, doctor and outpatient, and then another page on supplemental insurance, whether you need it, how much it is, that kind of thing. And then what's happened in 60 years is they add a little bit here, a little bit there. I mean, it took them all the way till 2006, which was pretty much 40 years later to invent Part C, Medicare Advantage. They had done a lot to it before then, and so that's why it's confusing. It's this government program that was simple in the beginning, and then it added, and now you've got a 131-page book that is focused on disclosure. And if you sit down and try to read it, you end up in some pretty odd places. So again, we've gone through here. We're going to try to give you an explanation of Medicare, and then just what we're going to do is reference the pages in the book where you can go back and read the documentation of that particular part. So in the first section, we're talking about starting or signing up for Medicare at age 65. So this presents a problem for people. They start researching it. Some people will start researching it at 64 and 330 days, like a month before they need it. But a lot of people will start in their early 60s and they'll read about it. They'll talk to friends. And a lot of times that's not real helpful because the friends are going to tell you what they did. And a lot of times they did what the guy down at work told them or their brother-in-law told them to do based upon his deal. And it's just kind of all this stuff comes from a lot of different places. When you're turning 65, it's a special deal. Is if you need health insurance or you're retired, you pretty much got to sign up at 65. Now's the time to get it. And if you are still working or your spouse is still working, you don't have to sign up for Medicare. You can stay on the work insurance and you can delay signing up for Medicare. And as soon as I tell people this, tell clients across the table, they're going to say, oh, what about those penalties? What I read that there's penalties. If you don't sign up right at 65, you're going to pay a lot more later. And so we have other videos about this. We're not going to get into a lot of details today, but if you are turning 65, you're still working, you're working for a large employer with group insurance, 20 or more employees, or your spouse is in that situation and you're covered under the insurance and you're turning 65, you do not have to sign up for Medicare. And later on, you can sign up for Medicare when you retire or you no longer have that group insurance. And we can help you get out of the penalties by filling out a form and proving to the government that you had this group insurance. So other videos on that. And I want to point out that COBRA does not work. I mean, by definition, you're not still working when you have COBRA. You're gone on the, which you're still on the same group insurance, but you're paying for it and it's under COBRA. That, if you're relying on that and you're 65, that won't work in getting you out of the penalties. You're going to need to sign up for Medicare and dump the COBRA. So, just generally speaking, at 65, you may or may not need to sign up. And when you do sign up, Part B is going to cost you $185 a month in 2025, plus IRMA. So if you're high income, you're going to pay more than $185 a month. You're going to pay a lot more than that. And we have separate videos on that. You can just go on our channel and find them. We're going to talk a little bit about that later. A lot of folks like to come to us. Both Tom and I are CFPs, and we can give you some consulting and look at your other things that are creating that income and maybe mess with that a little bit to put you in a favorable IRMA situation. So, Tom?
Yeah, I mean, I think of the mistakes that we see with people on Medicare, this is the area, this is the time that people make the mistakes, is when should they sign up or should they not sign up, right? That's really where a lot of the big mistakes can happen. And a common one, like Hans had mentioned, is people might be on Cobra. Maybe they've had some medical thing happen. They've met their max out of pocket and say, well, I'll just keep Cobra for the rest of the year. I don't want to go sign up for another insurance, have to worry about all that stuff. I know how it works. I've already met everything. I'll just keep it. Which is true, right? There's nothing inaccurate with that statement other than what they miss is that does not count as credible coverage for Medicare. So when they try to go sign up for Medicare, let's say 8 months later, a year later, they have a problem, right? Now they're facing penalties, and those penalties last for the rest of your life. And so again, that's a common mistake that makes. And then some people hear that and they go to the other extremes, like, man, I don't care about any of this. I'll just sign up when 65. I know I'm going to avoid penalties. Which again, you can do it. There's nothing stopping you from signing up for Medicare. But a lot of times that might not be the best choice if you're still working for a company that has more than 20 employees or your spouses. That also counts. A lot of times it might be better just to stay on that group coverage, delay Medicare, delay the IRMA if your income is high enough that you're facing that, and push that off to a future date. But you need to know which camp you fall in. And for an example, like Hans is 65, he's still working. We have group coverage, group health insurance here, but we have less than 20 employees in our company. His coverage was not credible. He had to sign up for Medicare. Now we're in the business. He knew that, so there's not an issue there. But a lot of people in his shoes, they're running the business. They're not thinking about this. They have the group coverage. I don't need to worry about Medicare, and they've missed their window. And now we meet them at say 70. Now they want to retire, and they never signed up for Medicare. We got a problem, right? Now we have penalties, and they can be kind of hefty for the rest of their life because they didn't know that they had to sign up. So again, I don't want to scare you and say everyone should sign up, because a lot of times we recommend that you don't. You just need to know which camp you fall in and whether to sign up or not.
Okay. So the next section out of the book that I thought would be real helpful is to define what's not covered by Medicare. What are the exceptions? What's outside of Medicare? Because I can tell you, if it's not covered by Medicare, it's not going to be covered by your supplement either. And let's go through these eye exams. I've been through, I don't get paid for my eye exam every year from Medicare. I have separate insurance that covers eye care and dental exams. We sell that kind of insurance, so that if that's something you're interested in, get in touch with us. Long-term care. Again, I have a separate policy, so does my wife. We're actually combined on that. Medicare does not pay for long-term care, custodial care in any way, shape, or form, and neither does Medicare. You need separate insurance for that. Cosmetic surgery. That's not one that I have played with yet. Massage. I'm getting these stretch massages every week, and Medicare does not pay for those, okay? And most massages they're not going to pay for at a chiropractor or just as a part of physical therapy. I mean, there's some situations where that's going to, but for just understand, you're not going to get paid for your massages. Physical exam, again, like when I go annually, they're checking high blood pressure or maintaining that, and cholesterol, some other things I've got going on. So Medicare ends up covering my physical exam because they're looking for stuff. It's an annual year. But understand that just a basic exam where you're doing a well checkup is not covered. Hearing aids, they paid for the exam for me, but they didn't pay for the hearing aids themselves, Medicare. Concierge care, there's a lot of these doctors go completely outside of Medicare and have you pay a monthly service that you can call them anytime or whatever. That's not covered. And most dental care. So I carry separate dental insurance and vision insurance, and we'll be glad to talk to you about that. Tom?
Yeah, I mean, I think the vision is one that I see can get people a little bit confused, because there are some things with your eyes that Medicare will cover. So I'm thinking of things like cataracts, glaucoma. There are certain medical stuff that happens with your eyes, and a lot of times you're seeing an ophthalmologist to have those treated. A lot of that stuff would be covered by Medicare, and if Medicare pays for it, if you have a Medicare supplement or a Medigap plan, it will pick up the rest, and we'll get into those details a little bit later in the show. What it doesn't pay for general, like your annual eye exam, if you're getting updated contacts or prescription lenses, it's not going to cover those type of things. But medical stuff with your eyes, Medicare will pay for part of that. The dental stuff, there's very few times it's going to pay for anything with the dental. Sometimes if you were like in an accident and they're having to do some reconstruction based off something that happened, it could have some there. But generally speaking, the dental is Medicare does not pay for that. And I do want to make the point, right? A lot of times people might be better off with an original Medicare and a Medicare supplement, but they've signed up for a Medicare Advantage plan because of some of Medicare Advantage plans. Now, that's again Part C, which is not what we're spending a lot of today on talking about. A lot of Part C's, how they market themselves is, oh, we cover dental, we cover vision, we cover some of these other things Medicare doesn't, which is true. Now, those benefits typically are pretty pared down. They're not real comprehensive, but they can include them in there. They can market towards that, but you're giving up other things to buy that. And so the real question is that really what you want to do? Do you want to give up some of your other medical insurance, some of the other benefits to get those other dental and vision, sort of pared down dental and vision? Maybe, or maybe not, right? It just depends on your particular situation. But don't necessarily fall for that. It's a marketing. I mean, they can market it, and it's not lying. It's true. But a lot of times you don't want to make your health insurance decision solely based off of those pieces.
Yeah, and a point I'll add, I'm getting cataracts in a year or two. That's going to be covered by Medicare. So there's a lot of eye stuff that is covered by Medicare. Tom said that earlier. It's the routine stuff that's not covered. So what's on pages 57 to 60 is they have a separate section, which is original Medicare, which is Part A and Part B. I got the card here, and I'm supposed to cover up the number. But so if you use this when you go to the doctor or hospital, you're on original Medicare. When you get on an Advantage plan like a Part C, you don't use this. You use your card from the Advantage plan to check in at the doctor. And what we want to talk about today in this whole video is original Medicare, is staying on Part A and Part B. And you can go to any doctor or hospital that takes Medicare anywhere in the country. So if you want to go to a research hospital, something seriously wrong, I have clients that go all over the country to get care, and they don't have to worry about whether they take their Medicare Advantage plan or not if they're on a Medicare supplement. So if you're on original Medicare, you can go anywhere you want as long as they take Medicare. You don't have to state a primary doctor. You do not have to deal with a network or look in network. There's no such thing on Medicare. And then you don't need a referral to go see a specialist. And where Medicare may be, original Medicare may be a problem for you is if you rely on it totally, is there's no yearly limit on the out-of-pocket. So on the 80% that Medicare Part B covers, that means you're paying 20%. There's no overall cap or limit on the 20%. That's why you need supplemental insurance. So we'll talk about that in a second. So Tom?
Yeah, I mean, I think this list really just gives you some of the reasons why you might want to consider staying with original Medicare compared to Part C or the Medicare Advantage plans. The networks is a big deal, right? I mean, I think, if you're just signing up for Medicare, you've likely had group coverage. That you have to check, does my doctor take this plan? Do they take Blue Cross? Do they take United Healthcare, Humana, whatever coverage you have to check if they take it. Original Medicare, you don't have to worry about it. All you need to do is ask, do you take Medicare patients? If the answer is yes, you can just stop the line of questioning there and say, okay, that's all they need to know. A lot of doctors' offices, and especially sort of the front desk people, don't understand this. And so they'll ask what coverage you have. Maybe you have a Blue Cross supplement or you have a United Healthcare supplement, which is the Medigap plans. And they say, oh, I have Blue Cross. They say, oh, we don't take that. What they're talking about is the Part C. They might not take the Medicare Advantage plan for that particular company, or the Medicare Advantage, but the supplement they do, they don't get to ask. That doesn't matter. And so this is an area we get a lot of calls, especially people who are just starting to Medicare. They're kind of figuring out. They go to their doctor and they call us, freaking out, like, "Hey, you told me this works everywhere. My doctor's office just told me they don't take it." It's like, well, hold on, let's pause. Let's call back. We sort of walk through it. You have to trust us on this. If you have original Medicare and you have a Medicare supplement, if they take Medicare patients, they have to take the supplement, no questions asked. So I just want to ease some concerns, because that's a common call we get for people who are just signing up for Medicare.
Okay, Tom, I'd like you to go in the show notes to where we have this comparison chart for the Medicare supplement plans. And this is one place that you may want to go in the book and take a look at, because this graph really illustrates why there's plan. Now we're talking about Medicare supplement, Medigap, why there's plan A, B, C, D, F, G, K, L, M, and N. I mean, once people hear that and they look at this, they're saying, oh my word, now I got to study 10 different plans. Well, you really don't have to, because all it really is this came about in 1990, just a little touch before Tom was born. And when I was talking about this and dealing with this bill, I could have never imagined myself being a person on Medicare still talking about this stuff. But these policies were standardized in 1990, 35 years ago. And so why is that? Well, during the 80s, 1980s, insurance companies were selling Medicare supplement, and everybody was saying, my plan's better than their plan, it's better than their plan. And agents like me and like the sales organizations I was working with, we would be changing people from year to year and getting paid a new commission on it. And it really wasn't right to be going to people and changing their supplement. We felt it was right at the time because we really felt like our supplement was better than the other guy's supplement. And that was one of the reasons. And the government said, enough with this stuff. And these insurance companies are inventing these whiz-bang features when they're not really that much different. Let's standardize them. And so we're going to make all the companies sell exactly the same thing. And that's what they did. There's 10 plans. So what we've got today is most people that purchase this either purchase the Plan G or the Plan N. Okay. And we could get some of these people talking on YouTube, they get philosophical, and it's like a Plan N is all you ought to ever have, and the Plan G is evil or something. It's not really like that. But there's some differences between the two. We have other videos on that. And if what you want is a Plan N, we can certainly offer that to you. And we do to many people. But we're going to pretty much use the Plan G, the Plan N, and then the high deductible G. And that's most of the people that buy this stuff from us. But which company we put you with is really going to be dependent on your preferences, the rates they're charging, because even though the plans are standardized, they're identical from company to company, they don't charge the same prices. So we're going to run you a price comparison, and we're going to buy off of that. We're not only going to use price to make the decision, but that's a big part of it. These standardized plans, this is true in all states except Minnesota, Massachusetts, and Wisconsin. Kind of an interesting, fun note is down here in the South, a lot of people improperly pronounce the state of Massachusetts. It has a 2 in it. It's Massachusetts, is if you get a good old Southerner and you ask them about that state up in New England. Anyhow, so those 3 states do not play the game this way. Their plans are still standardized, but they're done in a different way. The Medicare supplement is going to pay the co-payments, the co-insurance, the deductibles. The two fit together like a glove. Now, they're not going to pay all the apart amount that Medicare doesn't pay, and different ones pay different amounts, with the Plan G having the most benefits for the plans that are currently buying. Now, there is a Plan F available that's actually better than the Plan G, and the Plan F is only available to people that went on Medicare 2019 and before. So that's another little wrinkle that's kind of creates some confusion. The costs vary, but the plans are exactly the same. This 6-month open enrollment for a supplement is very important to notice this. And this might be a reason that you want to delay your Medicare signing up at 65, because this comes to people at 65. When you first sign up, the insurance companies cannot ask you any health questions. You got a 6-month window. You can buy any supplement you want from any company and no health questions. When those 6 months is over with, now this comes health questions in most states. Now, if you delay your signing up for Medicare, say you're 65 and you keep working, and then you sign up for Medicare at 68, this is delayed too, this 6-month open enrollment. It moves forward because it's really tied to when you first sign up for Medicare Part B. And another note I wanted to make is you cannot have a Medicare Medigap plan, what we're talking about here, and a Medicare Advantage. Those two won't work together. Tom?
Yeah, I mean, I think one thing that, I like that the government standardized these plans. It makes it easier to compare across plans. What is not great is the consumer, this might be you, never really understand this. They maybe you have, but a lot of people don't. A lot of people, they buy a plan and they never want to change it because it is good coverage. Once you get through all the craziness, all the confusion, Medicare and a supplement is really good coverage. I would sign up for it if I could right now. I'm obviously not old enough yet. But they give a lot of credit to whatever that secondary plan, that supplement they might have. And so they don't realize that you could switch to another company and get the exact same benefits, exact same coverage. You would not notice any difference, but you might be paying a lot less than you were otherwise. Typically, it makes a lot of sense to switch these supplements maybe every 3 to 4 years, right? Because these plans do go up in price every year as you get older. I mean, not every state does it that way, but most states, that's how it works, is it goes up as you get older. And when that happens, a lot of times after about 3 to 4 years, it can make sense to switch to a different company, assuming you can qualify because there is an underwriting component, and get that price back down lower. And so again, if you're interested and want to learn more about that, call us. But the standardized plans are nice, right? If you have a G plan and you're going to a G plan, exact same coverage. There is no difference at all. And so I think that's really helpful to look at these. And I would encourage you, if you're on Medicare and you've never shopped this around, because a lot of people, they sign up for one and they stay on it for 10 years, 15 years. You likely are paying more than you need to if you've never looked at switching this plan.
Okay, Medicare Part D is on pages 79 to 83. And you could put 20 to 30 pages on Medicare Part D, and it's going to have you all over the place. Here's the deal: is you need to sign up for it. If you go on a supplement, you need to get a standalone Part D drug plan, even if you're not taking a lot of drugs, because you have this same business of penalties for late sign up. Okay, we can go over that if you call us. You can. They're the same thing as delaying Medicare. So if you delay Medicare, you can delay the drug plan, and then you'll get out of the penalties because you delayed. But if you fail to sign up for one of these when you first go on Medicare, you're going to pay extra for the rest of your life. You're also going to pay IRMA on Medicare drug plans. And what you have is a deductible, you got co-payments, you got a maximum out of pocket. This just started in 2025 of $2,000. I just reached that in May. So I paid out $2,000 in deductibles and co-payments. And now from May to the end of the year, I don't give them my credit card anymore at the pharmacy. So it's pretty cool. That started this year. Moving on to IRMA, we have other videos about IRMA. So IRMA is income related monthly adjustment amount. That's a very kind of odd name. It doesn't imply what it is, but it's the Medicare tax on the well-to-do. And this can be planned for. They're going to use your 2 years ago income. So, it kind of comes as a surprise to people turning 65 in 2025. And then all of a sudden we're using their 2023 income to calculate their IRMA. But we can appeal it. If you're retiring, there's lots of things we can do. We can mess with your income, or on the financial planning side, your taxable income. So other videos, just understand this could be as much as $6,236 annually on each of you if you're a couple. So it's in addition to the regular Part B charges. So it's a lot of money. It's a big deal. It's not worth redoing all your financial planning. And actually, I pay this at a pretty high amount, and I'm overall pretty pleased with what I pay for Medicare, including the IRMA, because the coverage itself, along with the supplement, is so good. So, Tom, do you have any comments about Medicare?
Yeah, I mean, I think the Irma, the one thing that really can be a surprise to people is if they haven't watched any of our videos or haven't researched this Irma, it comes as a shock, right? They sign up, they get this letter, and like Hans mentioned, it's based off your income from 2 years ago. So you're like, wait a minute, what is this? Now, if you get that letter and it's right when you're retiring, because a lot of times that's when you're signing up for Medicare, you could potentially appeal the Irma. If your income is now lower than it was 2 years ago, just know there is a process and we can help with it to file an appeal, get that cost back lower, back to maybe the normal amount, or maybe not get rid of it altogether, but drop a couple IRMA brackets. Because if again, we have other shows on this, but there's various levels of IRMA. Some higher than others, obviously. And so, if that's you and you've gotten this letter, you don't know anything about it, and your income is now less, you can appeal it. So just go back and watch some of our other videos on that.
Okay, on every show when we're done, we start talking about comprehensive financial planning is how does this fit? How does Medicare fit within the 7 worries, the 7 subjects? And so we're going to go through. I mean, obviously, we talked about Medicare today. That's the topic of the whole video. Social Security is how you pay for your Medicare. It's how you sign up for Medicare at ssa.gov. So the Social Security Administration. We talked briefly about long-term care because long-term care is not covered by Medicare or your supplement. It's something you need to seriously look at some insurance for. We have other videos about that. We talked a little bit about income. And on this board, it's about planning your income through your retirement, but we always have an eye on IRMA while we're doing that. And we talked about taxes because it's your taxable income that drives more tax, which is IRMA. So I want to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.